Hello again. I'm Dr. Stephen Davidson, the Sexual Integrity Coach. Thank you for tuning in to another episode of Adult Sex Education. I hope you will like this video and subscribe to this channel. Subscribing is free, and right now I'm letting subscribers guide the content of the channel by sending me the topics that you want me to discuss. A subscriber recently asked me to talk about the pros and cons of testosterone replacement therapy, often referred to as TRT, and to comment about its use for enhancing sexual performance. First, if you're considering TRT, please have this discussion with your medical provider. That might be your physician or maybe physician's assistant, nurse practitioner, whomever you use for primary medical care. While you can buy anything on the street, I don't recommend that because it's potentially dangerous if you're getting something that you don't need or you're getting a dirty substance that could potentially be life-threatening. Testosterone is often referred to as a male hormone, but women produce testosterone too. We casually call it a male hormone because men produce it in larger quantities, and it is an important hormone that influences many of the ways men are biologically different from women. Testosterone influences behavior by increasing aggression, sexual appetite, and risk-taking behavior. It causes men to be more competitive and sexually aggressive. In men, our testosterone levels naturally fluctuate throughout the day. They're highest in the morning, and this is one factor why many men wake up with erections or prefer to have sex in the morning. Generally, our testosterone levels, or T levels as they are sometimes referred, are at their highest in our late teens and early 20s. Around age 30, T levels begin to drop about 1% a year. It's important to remember that this decrease is normal, and even if your T levels are less today than 20 years ago, you might still be in the normal testosterone range. So you don't automatically need testosterone replacement therapy just because you're getting older. I have male clients in their 70s who are not on testosterone replacement therapy, and they still have healthy bodies and very active sex lives. I'm 63, and my T levels are normal and healthy without TRT. Now, I'm no longer interested in chasing everything I wanted to chase when I was in my 20s, but that might be more due to increasing wisdom than decreasing testosterone. Testosterone is important for good sexual health, but it's not the only thing that influences sexual performance. Having high T levels alone will not guarantee that you have a great sex life. Our sexuality is very complex, and there are many factors that influence our sexual health. Testosterone replacement therapy is frequently recommended for men who have been diagnosed with low testosterone. Again, that diagnosis needs to be made by a licensed medical provider. It can be administered by a topical gel or by injection. Some of the symptoms of low testosterone include dysphoric mood, difficulty concentrating, fatigue, low or no libido, fewer spontaneous erections or decreasing ability to maintain an erection, decreased muscle mass, and increased body fat. Some of these symptoms are also symptoms of depression, and some men have been misdiagnosed with depression when they were actually experiencing unusually low levels of testosterone. Keep in mind that fatigue, dysphoric mood, and changes in libido can be due to other factors as well, so don't be too quick to jump to the conclusion that your T levels are low. Your testosterone level can be easily checked with a blood test. Trans men use testosterone injections as a means of acquiring more masculine features. This is often why it's referred to as a male hormone, because it does masculinize behavior and appearance. Testosterone is a factor in increased facial and body hair, deepening the voice, developing a receding hairline, and increasing muscle mass in the body. Some trans men have commented that they had no clue just how strong the male libido could be until they began testosterone replacement therapy. TRT is controversial because there are so many people injecting testosterone now who don't need it. Their T levels are already normal, but they want to feel sexier or stronger. And sex and beauty are big money makers in our capitalist culture. So where there is demand, there will also be supply. Some of these men are dealing with body dysmorphia, low self-esteem, or anxiety that impairs their sexual functioning, and they can be susceptible to those looking to profit on their vulnerability. There are risks associated with TRT, especially if you don't need it. Some side effects include enlarged prostate, acne, sleep apnea, blood clots due to increased red blood cells, heart attacks, strokes, and even death. This is why I strongly encourage you to consult your primary care physician and use TRT under medical supervision, as opposed to getting it from your fitness trainer, cosmetologist, or the Avon lady for those of you who are old enough to know what an Avon lady is. This is also true with sexual performance drugs. Even men in their 30s are taking PDE5 inhibitors that they don't need, trying to be sexual supermen or overcome sexual problems that are more relational or psychological. These drugs are not anxiety medications, and they won't make your cranky girlfriend stop nagging you. So they frequently don't work for men with sexual performance anxiety or men who are in relationships with partners that they no longer want to penetrate. They're great for men who need them, but most men in their 20s, 30s, or 40s are able to get healthy erections in situations where they feel aroused and emotionally safe to engage in sexual activity. Testosterone is a natural hormone, and there are some natural ways to increase it. Weightlifting. You don't have to be a power lifter, just reasonable and regular resistance training with weights will naturally boost your testosterone levels. Eating enough protein in your diet. Maintaining healthy vitamin D levels by exposure to sunlight or using vitamin D supplements when necessary. Getting healthy sleep between 6 to 8 hours per night. Regular sexual activity. No smoking, and reducing alcohol consumption. Generally speaking, if you have good physical and mental health, your sexual health will likely be good as well. I'm Dr. Stephen Davidson, the Sexual Integrity Coach. I hope you will like this video and subscribe to this channel. Check out my website at sexualintegritycoach.com. There you'll find links to both of my books, Peaceful Mind, Peaceful Life, the guidebook to happiness, as well as Sexual Integrity, Finding the Courage to Be Yourself.